Hey there, Pyle coming at you on a beautiful spring day in Raleigh, North Carolina. I'm here to teach a little bit about something called an auto-augmentation. It is a version of a breast lift. I think the term auto-augmentation being a version of a breast lift is confusing, and that's probably why there are so many questions that we get in Bus Mob about it. It's not super clear, and I want you, if you're coming for surgery or a consultation at an Amelia, I want you to understand how we do it. I also want you to understand how the rest of the world does it or views this term, so that if you're going somewhere else, you have good context. So, in its simplest form, auto-augmentation defined means augmentation with your own tissue. Auto means your own, augmentation means filling. Augmentation with an implant is different. Auto-augmentation is not the same. It is basically an evolution in lift surgery, in breast lift surgery, that takes something we used to throw away, tissue at the bottom of the breast, and uses it instead to fill a little bit the center of the breast. I say a little bit because that's what it is. Like, I think to some degree, if you imagine an auto-augmentation doing the same thing as an implant, you will be disappointed. It does not. An auto-augmentation is like that much tissue. An implant augmentation is that much implant. This can do what that does. And so if we expect it to, we'll be disappointed. I don't want you to be disappointed, so I want you to understand it. So first, where does this tissue that we're going to use come from? The answer is the bottom of the breast. In some versions of a lift, your breast is made intentionally mildly smaller. The bottom heaviness of the breast is removed, which creates a little better balance between the upper and the lower parts of the breast, and your breast is made smaller as a result. Now, if a smaller breast as a part of your lift is the goal, perfect. That's the right answer. If a smaller breast is not your goal, you want to stay about the same size, there's a way to do a lift where that tissue is not, like it was in the olden days, thrown away, but is instead used to create a slightly better shape in the middle of the breast. So in an auto-augmentation, that tissue at the bottom that we used to get rid of, we're now going to use and push up to the center of the breast behind the areola to create just a little bit, in fact, about that much, more fullness in the center of the breast. So auto-augmentation is just using your own tissue to fill a little bit the center of the breast. It is not the same as fat transfer, which is also kind of disappointing for most people. It is not the same thing as an implant auto-augmentation, and it is not the same thing as a lift back in the day. So the bottom line question you need to answer is, do I want to lift? And if I do I want my breast to be a little bit smaller, in which case you don't want an auto-augmentation? Or do I want my breast to be about the same size? In which case, you probably do, because there's not a lot of downside to moving that tissue to the middle of the breast for most people. Hope this helps. Have a great day.